Hi, everybody. Welcome back to my image evaluation series. Appreciate you guys tuning into these. Today, we're going to talk about an X-ray that we don't do very often. In fact, I don't remember the last time I did AC joints, but it is a possibility that at some point we will have to do them. But I want you to be able to know what to look for. So we're going to talk about AC joints today. We're going to use the same acronym that we've been using, the PACEMAN acronym, and we will just run through and look at a couple pictures of AC joints. So we take two images. They're both AP images. So we've got the patient's back against the image receptor. And we're going to do one without weights and one with weights. And let me kind of show you what we're looking for on these. So this is an AP uh, without weight image. In a perfect world, there's going to be a marker here that says without weights. Uh, but at the very minimum, you need to put a marker on there that says, with weights or weight bearing on your weight bearing image. So let's talk about the non weight bearing image first. Okay, this is an AP AC joints. So we're obviously looking at the AC joint where the clavicle meets the acromion process right here. Uh, it's preferable that you get both AC joints on the same image for comparison. Um, if you've got a bigger individual like me, it'd be very difficult to get both AC joints on one image, so you'd have to split it up and do two. Uh, but if you've got a smaller person, you can very easily get both on one image. So all right. So the area we're looking for on the AC joint is obviously the AC joint. So, like I said, that's where the clavicle meets the acromion right here on both sides. Okay. And you can see that both are demonstrated on this image. Uh, Position wise, I don't see any rotation. You can see where the clavicle meets the sternum right here on both sides. They're both fairly close, or the joint spaces are fairly are similar in size. I don't see a lot of rotation here on this picture, so that's a very good job. And we've got the entire area that we need to see. So collimation wise, we've done a pretty good job. Uh, so collimation wise, superiorly, we need to be able to see the skin margin up here above the AC joint. Okay, so we've got plenty up there. Down here inferiorly, we need to be able to see the humeral head. Okay, so we need to go far enough to see the humeral head, which we've accomplished right here. We can see both humeral heads right here. Uh, and we're open all the way laterally, so we can get both AC joints on the same film. So good job there, collimation wise. It could be a little bit tighter, centered a little bit lower, but yeah, good picture nonetheless. Exposure wise, we've got a good picture. We can see our joint lines on both AC joints here, right? Okay. We can see the corcoid process here staring at us on both pictures. Um, we've got good differentiation between skin and the periosteum of the bone. So we can see bony cortical and intermedullary spaces as well. But the important thing is we can see those joint spaces between the acromion and the clavicle. So exposure wise, yeah, it's a good picture. We do have markers; they're both marked. We've got a right on this side, which it looks like the right on this side was actually placed there. It's a right marker, and the left one is computer generated, which is okay. As long as you know what the right side is, you can place a marker on the left side. It's important on these that we do use a metal marker, because if we take this image and it actually shows up on the image computer flipped, we may be looking at the wrong image, okay, or the wrong side. So make sure you use either a right or left marker, yeah, not in the anatomy, so we know which side is which. Uh, Aesthetically pleasing picture, absolutely. Um, Yeah, it's a good picture. We cut a little bit close on this side. On the lateral side, we should be able to see the acromion, the end of the acromion, where it swings around right there. We're really close on this side, but we can see those AC joints. So I would accept this film for sure. That's the AP. So let's move on to the weight bearing picture here. Same patient, um, but you'll note that it's got a marker that tells us it is a weight bearing, which is very important. Um, uh, on a side note, the weights that we use for an AC joint separation test are 5 to 10 pounds, depending on the size of the patient, and we do affix those weights to the wrist so they actually pull the arms down. We don't want the patient holding those weights with their hands. Um, anyway, okay, position wise, I see very little rotation. Um, you can see that it is weight bearing. You can see that the weights are pulling down on the shoulders right here. The traps are a little more visible here. And you can also see that the clavicles are a little bit flattened out, and we're able to see uh, the AC joints quite readily. Um, area wise, yeah, we can see what we need to see. Like I say, collimation wise, we want to be able to try and see the end of the acromion here, like we do here. And this patient size wise is really close to not being able to see both sides. But we've done a fairly good job on centering, so we can see both sides. So collimation is sufficient. We can see humeral head here and the humeral head here. So inferiorly, we are fine. We could collimate a little bit tighter, but laterally, we're collimated out all the way. So, um, yeah, good job collimating. So this is what you need to see on a weight-bearing AC film. Exposure-wise, this one is a little bit darker than the other one. I'm not sure why. I don't know if they changed techniques or what, but still passable. We can see differentiation between bone and soft tissue again. We can see joint spaces really well. Uh, there's not a lot of quantum model or noise in the image. Everything's pretty sharp. Uh, Periosteum wise, we're able to see nice clean lines. So yeah, good enough for the exposure. I'm guessing this was shot at 70ish kVp at maybe 10 to 12 mass. You're going to shoot these very similar to what you shoot a shoulder X-ray or a clavicle X-ray. Just for frame of thought. Okay, good job. Marker, yep, we've got a right marker here, left marker here. Good job. We need to be able to know what side is what. It's just like that patient is looking at us, so we know that that's the right and that's the left. Okay. Uh, yeah, good image. Aesthetically speaking, um, very nice image for a weight bearing film. Uh, there may be a subtle separation right here. You can see where the clavicle is raised above the level of the acromion on the left side here. Very, very minute, if any. Um, okay. I just wanted to show you this next film. This is an AC separation of the right AC joint. You'll note that the left AC joint is fairly symmetrical with the end of the acromion right here, the acromion process. We go over here to the right side, and you can see that the clavicle lies above the acromion right here. Uh, so there's probably like a grade 3 AC separation, and those can be repaired through therapy. They can also be surgically repaired if needed. If they do surgically repair them, I've seen plates that come off the end of the clavicle and kind of hook under the acromion. I've also seen where they've placed a screw through the distal end of the clavicle down into the scapular body to kind of hold that clavicle into place. But most of the time, these can be dealt with physical therapy and rest. Um, but anyway, this is what you're going to be seeing if you see an AC separation. Uh, Pretty easy to spot. Just if that clavicle isn't similar to the acromion uh, in respect to that joint and lays above, it's usually a separation. So anyway, guys, this is what AC joints should look like. Uh, we should be able to try and get both ACG joints on one film. If we can't, of course, you just split it and take two films. It's important to get that uh, differentiation between the right and left, so we can see if there's anything out of line, or if it, maybe they walk a little bit higher than others, and it's the same on both sides. Uh, but just remember that to try and get both on one film if you can. If not, get two. But this is what we need to look for. We collimate kind of like a clavicle. We don't need a big, huge chest X-ray to see those AC joints. And the more you collimate, the better your picture is going to be. Anyway, I hope this was helpful. I know we don't do a lot of these, but when that time comes, I want you to be able to know what you need to look for. So appreciate you guys watching this and watching all my content. A lot of useful information out there. I hope you guys have a great weekend, and we'll see you next week. We're going to do an evaluation on chest X-ray, which is something that we do a lot. So we will see you then, guys. Have a good day.